So thank you for having me. Thank you, Janice and Larry, for inviting me. And it's great to see all of you here and seeing that you're invested in the Democratic Town Committee, which is really important, and we really need your support. I just came from an event with Catherine Clark, and she was talking about Washington and how the Democrats are sort of sitting around watching what the GOP is doing, and kind of incredulous because they don't have a partner. You know, there's no partner to sit down and talk about the real issues that are facing, you know, middle class folks in this country, and how do we ensure that we have a stable middle class, that we end hunger, which is now absolutely on the rise. And I think what you saw, 1 out of 3 children, I think, in Massachusetts has food insecurity. I mean, that's in Massachusetts, so you can imagine what it's like across the country, and just all of these issues that people care so much about, and none of that's getting done. They're, you know, censuring Adam Schiff, and they're, you know, talking about, and they're expunging the impeachment, and they're, you know, and they're letting George Santos walk around, and, you know, and this is what we're up against, right? So I think there's nothing more important right now than having really active Democratic committees that can help where we're needed to get our Congress back to a sane place, you know. And sane doesn't mean that everybody agrees all the time. It means that you're willing to sit down and have real conversations, substantive conversations about where people, you know, what we should do. These are complicated issues. So that was kind of depressing. But she's great, and she's not Burlington. But it was a interesting take on what was happening. So I'm here to talk to you and listen to you and have you talk to me. And, you know, I'll just briefly say a little bit about what I'm up to. I am the Senate Chair of Healthcare Financing, which means that we get all of the bills that have to do with healthcare in one form or another. And that, you know, it's a very, very wide range of bills. And we're spending a lot of time, my staff, which is phenomenal, spending a lot of time trying to really make significant headway into all of the issues that are facing healthcare today. And they come under access, cost, and quality. And we're working really hard to address those in a way that where the consumer or the patient will see the results. And so we spend many hours every day dealing with those issues. And then I'm the vice chair of the Senate Ways and Means Committee. And again, my focus in that, in the budget and on the Ways and Means Committee, is the healthcare space. So when we look at budget items that have to do with healthcare, whether it's hospital spending or long-term care or workforce for healthcare, that's my sort of area that I focus on. So.
Okay.
All right. So it was.
I see a hand.
Is there? Why don't you ask if there's
Is there anyone have a question offhand?
I do.
Sally, go ahead.
And that
Hi,
is, you know, we're in a blue state. Our Congress people are Democrats. What can we do? I'm wondering if the House Democratic leadership or the Senate Democratic leadership, but the House, has any thoughts on what we can do to help move people in other parts of the country?
It's a great question. I remember having a discussion with Maggie Hassan in New Hampshire and saying, how do you all feel about these people who come up from Massachusetts and knock on your door? Because I would think, why would that be a good thing, right? And she said, we love it. We love it. New Hampshire people are engaged. They want to talk about politics. And we love it when folks come up and support us through door knocking and calling. So, but I want to say one thing before I talk about the country. We risk everything if we take our state for granted. And there are, when you look at the numbers in Massachusetts, 29% are registered voters are registered Democrats. A much smaller number are Republicans, but the majority of people in the state are independents. And I know there's lots of different reasons why people are independent, but one of the reasons is because they're not going to just sign up for the Democratic Party. We need to engage them and ensure that we're listening to those people in those parts of the state which have different focus than we do. We can't take that for granted. And I worry that the Democrats do that. I hear a lot, oh, this is Massachusetts. Well, it is Massachusetts, and we have done some amazing things that I'm deeply proud of, but we can't take that for granted because there are people that are hurting. There are people that can't afford to live here. There are people that don't have food on their table. There are people that can't get to work because our transportation system is a mess. We need to pay attention to that because that's what brings people into our fold. And it's also what keeps people in Massachusetts and happy, and we need that. We want people to come here. We want our kids to be able to live here. And so I just want to make sure that we don't lose that focus and don't rest on our laurels. I think that what I've learned about being in other states is listen to what the other state wants you to do, right? If somebody, we heard a lot of, there was a lot of discussion in the last go-around, the last presidential around, well, should we come knock on your doors? Should we do and a lot of people on the ground said, no, support us with resources. Help us get this message out. Help us do some language around the issues that we can send out to people. Things that they can get support while they're on the ground. Because if you think about it, how do you feel about people coming and knocking on your door? How do you feel about people calling you on the phone that aren't people that are connected to your community? So what we have to do is help get people out that are in those communities that are connected, because that's the most powerful way you can change people. You live here, I live here, we both have some skin in this game, this place matters to both of us, let's have a conversation. So I think that just finding ways that we can support our fellow Dems working in other states is a great way to do it. And there's places like Force Multiplier and other groups that actually do that kind of work and swing left, that.
No, I don't.
That's, so those are the places that, I would look to. And if someone says, will you come knock or will you make phone calls? Make phone calls, because that's what they've asked to do. But it's their agenda, not our agenda. And I think Democrats have some trouble with that. Democrats are very good at telling you what the agenda should be and what's, the perfection test, right? And we need to be better at listening and finding people at where they are and bringing them along. So.
Well, for the national election in 2020, when do we do the
2020.
postcards?
Oh,
Why don't you describe that?
So for the 2020 election and also in the Georgia elections for John Ossoff and
Raphael.
we were with an organization that we got lists of
Yes.
people and we sent the postcards, and we had a script.
Yep.
We hand wrote
Yep.
the script on the postcards and addressed it to people
It
Yeah, we
reminded
did.
people
And
to
we did
vote, it
reclaim our
reminded them
vote.
where their
That was
voting place
reclaim our
was.
vote,
Yeah,
right.
right.
Reclaim
That's
our
what I
vote, reclaim our vote, and I don't know if, I mean, well, they both got in.
Yeah.
And so I think it had an impact.
Yeah,
I
that kind
really
of
do.
thing I think does. Again, it's coming from those places saying this is what we need. And it's huge financial support for them because we did the same thing.
Yeah,
Because
yeah,
we're
yeah.
putting the stamp on and we're, and so
Right,
it's
right. And that's something that we as a DTC could also do.
Yeah, it's grassroots activism.
absolutely.
I did text banks all over the country, all over the country.
Yeah.
I have Slack accounts, and you wouldn't even believe what places, all over the place.
Yeah.
And I would spend like 3 hours a day texting, like the whole time during election. It was like a part-time job for me.
Yeah.
But, and not you don't get a lot of responses, but you might get some.
Yeah.
And you might be able
Right.
to answer some questions, and people that have trouble with their registration or give them instructions. There's so many things you can do.
Right.
Yeah.
So Cindy, one of the questions that came in, the estate tax, which as it stands right now, we're probably all, if it would be hit by it, because you go over $1 million and
Yeah.
$1, and then your entire estate, and with a cost, with the value of real estate today, we're probably all hit. So
Well,
when can we expect something?
Well, the thing, just for people who are not aware of it, the difficulty is what is called the cliff effect.
Right.
The cliff effect is if you have an estate, you pass away and you have an estate, that estate has to pay a tax called the estate tax, okay? And if it's under $1 million, you don't pay anything. If it's 1,000,001, you pay the estate tax on the whole 1,000,001, and includes the base, that threshold. We are one of only very few. We're actually, us in Oregon is one of the few states that has an estate tax with a threshold like that, that's that low. Everyone else has raised it much higher, and it's on the incremental above a base. So it's either above 2 million, above 3 million. It's not like this cliff effect.
And without a cliff effect. And so anybody with a house, I mean, you're gonna reach, just because, go ahead, what's the status?
Yeah. So the status is that there's they're in conference committee, so what happens is the House passes their version of the tax, the tax package, and then the Senate does their version, and then they sit down and they have to negotiate a compromise. There's the estate tax is a little different. They both raise the tax the exemption to $2 million. They both, on paper, they've smoothed the cliff. All right, so after $2 million, you then pay tax on the first dollar, and then you pay tax on the $10. So that unfair kind of regulation would go out in both of them. The Senate basically, and they both do it through tax credits, okay, a credit. So what the Senate does, and I'm going to get this right, is they give you a $99,000 tax credit because that's what you would pay on a $2 million house. Okay, so and I think it's they cap basically the tax credit, right, at $99,000, because $99,000, I believe, is what you would pay in taxes, in state taxes, on a $2 million
Estate.
or $2 million revenue or whatever, your on when you would file your taxes. Does that make sense?
Who
I'm
pays
looking
that
at you.
tax credit? Who would get the tax credit? 'Cause they're-
Everybody, anyone who pays, if you sell your house so you get a total tax credit if it's $1.5 million, it's not taxable. Okay, if it goes to $2 million, you basically get a reduction in your taxes of $99,000. Then then the tax kicks in, right? So then you have to pay tax on the $1 or the $10 or the 100,000,
This is anything over here.
anything over.
This is
It's
after
still
you,
taxing from $1 of the 2 million, but they give you an offset for it.
They give you an offset for it, yeah.
Isn't that a little complicated?
Yeah.
Yeah.
Of course it is.
Well, it's only complicated once you get to, I'm not sure how else they would do it. I mean, you're getting, how else would they do it?
Just say this, you don't pay a tax until it goes over 2
There's no
million.
tax on
Oh, okay.
the first 2 million.
But I think, no, they both do that. So there's a way, but the House does that as well, except they let you take the federal tax credit first,
Sponge tax.
and then, so you get a better deal if you're richer with the House,
always.
right? Because you're now reducing your tax, you're now being taxed on your overall income, right?
So that's designed to, what we call a sponge tax, to help you with the federal.
Yes.
Why would the House make it easier for the rich to?
Well, one would argue that the House tax package is very much focused. I mean, the capital gain, the short-term capital gain is a tax on people who are, well, let's put it this way, they're not your regular working class family, right? I mean, most people that do short-term capital gains are day traders. I'm not sure how, it's not the first tax I would pick if I wanted to help people, whereas the earned income tax credit is something that is just so important to everybody, especially when you're on a lower tax bracket. That makes a huge amount of difference, and we've raised that. But am I not saying this right?
No, you're
Okay.
good.
Because I think that's the difference, is that why they did it, I'm not a tax person. This is way out of this is sort of
No,
beyond
it makes
my.
sense because you'll have to declare it for federal.
You
so-
have to declare it, so you're getting you're getting a $99,000 reduction, right?
Yeah.
This is after you've already subtracted out what it cost you to buy the house and your renovations, correct?
Yes, it's you get the other discounts, rebates, right? Because that's not part of it, right?
It reduces the tax
You got the
rate.
first
It's a
and the
complicated
federal,
way to
yeah,
do it,
the
but
one
it
time.
does reduce the tax
Right.
rate.
But I wish they'd increase it to
Right.
3 million.
Well, there was a lot of discussion. I think the governor had, I think hers was higher, but had a cliff effect.
It was high.
Right, and it had a cliff effect, whereas both the House and Senate, you basically are protected from that first 2 million, and you only pay what's above that.
What are the chances of this coming out of committee?
That will absolutely come out of committee. It will, I guarantee you that that is going to come out of committee, that there will be a compromise.
Both the House and the Senate.
Both House and the Senate will compromise, yes. And it will be something, there won't be a cliff effect. The question will be whose plan will they accept in terms of how to do the credit and how it gets
So you
taxed. But
see
it will
that
definitely, I see
this-
that,
this
absolutely.
session? This
I
session?
see it in the next month,
Oh, really?
yeah,
Awesome.
yeah.
Great.
Okay, shall we go on to another subject?
Yes.
Nadeem over here brought up one of them, and he basically said that, by 2035, the U.S. is supposed to be completely converted from internal combustion engines to electric vehicles. And he brought up the fact that Massachusetts requires apartments and condo buildings to have only one charging station if it's more than 15 units. The problem is that if you have a building that's 200 apartments, okay, one charging station is not going to cut it. Is there anything in the works that is to address this issue, which clearly needs to be fixed?
So I think the environment, these things, these bills are in TUE, Telecom Utilities and Environment. That's the name of the committee that does all of the work on the climate bills. And I think that is one of the things that I saw is being discussed is how to increase access to the charging stations, because it's an issue across the board.
I would not call this a climate issue. This is a common sense, it's a transportation issue, and it's also a fairness to lower income people.
Yeah, I didn't mean to call it a climate issue. I just meant that's the name of the committee. That's who gets all of those bills, so.
I think it's very easy for us, you're all probably here homeowners, and people, you know, the House representatives, they're all homeowners, and if they chose to have an electric vehicle, which increasingly more and more, I'm sure do, they can easily install a charger. If you're in an apartment building, if you're a dweller in Somerville in a triple decker, you cannot have an electric vehicle. So in a few years, you will be condemned to drive older vehicles that go on gas, and you will pay more in fuel costs versus lower electricity costs. And it is simply a matter of fairness. These people are left behind. We now have to start thinking about the infrastructure today in order for this infrastructure to be in place in 10 years. Nothing happens in 10 years. We have to start, this is an urgent matter.
Yeah, I don't disagree. I'm just, you know, I don't disagree.
So we could probably try to get some information from that committee and see what's.
Well,
going on.
yeah. And I can also, you know, it's easy for me to let them know, to let the Senate chair know that we are hearing this as a real issue. And putting it on the, you know, having that, because there will be another, whether you want to call it or not, a climate bill, and that's what it will, and those are the kinds of things. It could be in economic development, could be in a number of places, but I know that the TUE is where they are looking, they tend to look at these issues.
I would appreciate if you could bring it up.
Yeah, happy
with your
to.
colleagues.
Happy to. Give me a pen.
Discussion in urban areas to basically have, looks like a parking meter with underground wires to plug in, and you need a credit card or whatever, but there are ways to make them available for on-street parking in dense urban areas.
Oh, wow.
It's just discussion, I don't know if it's actually
Yeah.
done anywhere.
Yeah. Well, I now know there's something, and I don't quite understand, but Tesla is now required to allow any car to
It's like a European fitting your US plug.
It's just a plug. I mean, the decision has been made. The industry is going to a single plug, which will certainly help.
Yeah.
It doesn't matter if it's a Tesla or not.
No, but they didn't allow. I thought
They were separate. They had their own standard.
Right.
Everybody's going to use that standard.
Yeah.
So, but, you know, that's great. That helps.
a little bit,
more
right?
Places where everybody can charge, but at the end of the day, this really does not help people who live in an apartment or
Yeah.
who live in
We
urban areas.
we don't have a charging station in the State House parking lot.
And there should be one.
Yeah.
There should be one, but we really don't want, we have to move away from this charging at your workplace. You really don't need to charge every day. You need to charge every 5 days. And the easiest way to do this is at your home.
Yeah.
Overnight. And if you don't have that luxury, now this becomes a problem. Now you have to find a place.
Yep, I get it.
So the next one was a question from me. And so we frequent, my mother's at a nursing home, and they are always looking for CNAs. There's a chronic shortage of CNAs. And I talked to the administrator of the nursing home.
Tell people what that is.
A certified nursing assistant is a CNA, but they use them in hospitals and any healthcare facility. That a lot of these people, they take the CNA course and they can pass it. An awful lot of them are immigrants. And then they have to take the test in English. And they may have conversational English or enough to get by. They don't have the skill to pass the test in English.
Right.
And if they could take the test in their native tongue, we would have a lot more CNAs. So
I actually have talked to SEIU about this, Service Employee International Union. They are the big union for CNAs. And they've been talking to the Department of Public Health to see what can be done about increasing access to the test. We're also, actually today, I spent some time reviewing an omnibus long-term care bill, nursing, we call it a nursing home bill, but it's got more than that in it. There is a big part of that talks about grants and programs to support CNAs getting language support and also getting training and putting them on the career ladder so that they can become CNAs, stay CNAs and get certified, move up from the CNA, and there's a big part of that bill that focuses on workforce. I did have a conversation with the sponsor of that about requiring that the test be given in at least Spanish and Chinese.
And also Creole is a
right.
big one.
CNA's a Ugandan, so you can.
Yeah, I mean,
And a ton of them are from Haiti.
yeah. Now, but we got to get them. We can't do all of them at one time, otherwise we'll have to wait. Right, so we say, okay, what's the most popular? Spanish is clearly the most popular. We would start there, and then, I mean, if it's Creole, I'm happy with that. But we require them to do that. That the pushback is, well, you need to know English in order to serve your patients, right? And there's a huge difference between conversational English and,
Take a test.
and academic or, business language English. So I think we have to maybe tweak this a little bit, but that shouldn't be a barrier. So we're looking at it. SEIU is talking to DPH about it, and I think I think now there's a greater sense that we need to address this, and we should do it in the short
Because
term.
There aren't a lot of people that want to be CNA.
Oh, no, well, we pay them $17 an
Right,
hour to do one of the hardest jobs there is to do. So,
People like me didn't know what CNA is. What is CNA?
it's a certified nurse
assistant.
and assistant, certified nurse assistant.
Take the vaccine.
Huh?
Right,
The
right.
nurses
Quit
don't
during the
do.
That's
pandemic
right.
because they were anti-vax.
Right, there were a certain number, but those people, a lot of those nurses have come back because it's no longer a mandate. So we're seeing that
This was
the
printed out
return.
ahead of time, so you can
But
just
if they
read.
found another job that was easier, pay the same money, they're not coming back.
No, well,
Good riddance is what
Pays
I-
less.
They didn't want to get vaccinated.
well, but these are people that are also, they're doing an incredibly difficult job, and they can go to Amazon and set their hours, or Walmart, or, Target, and set their hours and
We'll move down south.
move, and you got to put food on your table. You can't.
Okay, so we have two more items for the evening so far as I'm aware.
No, we have the number 4, the hearing.
Number
one.
4, and you have one.
And Phyllis, yeah,
Phyllis
yeah.
has one. Okay, so we go to visit Janice's mother regularly at the nursing home. And she's very hard of hearing. I mean, she can barely hear with the hearing aid, never mind without it, you can imagine. And oftentimes, we would get to the nursing home, and we would find out that she can't hear anything, and the hearing aids are in. Well, the hearing aids are dead, and they're plugging up the ears. And so we finally got them to regularly change the battery. But then we said, sometimes you have to, once every couple of months, you have to just pop in a new filter, pop out the old one and pop in a new filter. And no, we won't touch that. If something goes wrong with it, we can't handle that, and so forth. So it occurs to Janice and myself that perhaps what is needed is the state to come up with some legislation that might mandate that one person trained to maintain the hearing aids, which is not, I mean, if I could do it, I mean, anybody could do this. Okay, it's not very complicated. And perhaps if the person is trained, that somehow there's some provision for indemnification so the nursing home is not responsible if something happens.
I mean, there's so many people there, like, we're there all the time, so there's not an issue for my mother. There are so many people there that do not have family coming. So once those hearing aid, the filters need changing, they're out of luck.
Yeah.
There's people
That's it.
that are sitting there, living in existence in complete silence. They can't hear the person right beside them. They can't hear the CNA talk to them with instructions. They can't hear the nurse say good morning. They can't hear anything. And nobody does anything
And they
for them.
won't touch the filters.
I
And-
was on a seminar not long ago that interference with hearing accelerates dementia. They can't find a cause and effect, but they got a very good statistical relation. So people need to
Yeah,
have better hearing.
I think it's a really interesting idea. It's never come up before. I've never, but I'm happy to look into it and see.
Most of the new hearing aids are rechargeable batteries though.
But they filter.
It's the filter, I mean, they
Yeah.
need some minimal maintenance.
So
Yeah,
they're-
we
they'll-
can-
yeah.
And they will not go near them. They will not touch them. I just learned how to
Yeah.
pop in a new filter.
Well,
Yeah.
so
So-
the thing is, this probably comes down to, like we were talking about ESPs earlier, we were talking about CNAs. How much do those people get paid in the nursing homes?
Right,
You know what I mean?
exactly.
No, but even the nurse will not touch the filter.
There's a little click.
We don't
I
do
think
that.
this is
Where
a,
I was going with it is it's a
Yeah.
business, okay? And
Yeah,
they're about
yeah.
making money, because that's why businesses exist, okay? So they're gonna try and minimize their costs and minimize their exposure. That's all I was gonna say.
but happy to look into it.
Thank you.
Yeah, I mean, what you're saying is the overall salary that the CNAs get is probably, equivalent to like what the
It's
paraprofessionals.
That's-
equivalent, right? And so
Yeah.
we need to make all these jobs,
That's why
jobs
they
that people
work in
wanna
more
do.
than one place.
Might be a good, that omnibus bill might be a good place to snake in a clause into or something
Well, I
into
mean,
it.
so here's the thing, it's easy
Yeah.
enough for people to say, well, they can just go get another job, okay? Maybe, maybe not, okay? But the thing is, these jobs that we need to fill, okay, we need to make them jobs that people want, okay? That's salary, that's working conditions, all that stuff, okay? And I'm just looking at nursing homes, and they've got a bad rap, okay? And my dad was in a nursing home before he died, okay? And they deserve the bad rap in a lot of cases, okay? Because they hire, the quality of people that they hire, okay, is directly related, I would say, to
The bottom line.
the bottom line.
Doesn't it have to do with the Medicaid funding, though?
It's complicated, okay, because what's happened in the nursing home industry is that it's been taken over by private equity.
Exactly.
And so,
Right.
yes, Medicaid is a culprit in terms of what they, how they reimburse. But the model is different. When you're I believe that when you are a private equity entity, you are not about providing services, you are about making a short-term investment for a large gain. That is why you exist. That's different from, venture capitalists who tends to be more, we want to build a company, take it public, have it be successful, so we'll get, private equity is how do we make money fast for the shareholders. So it's that, the combination of that and the combination of Medicaid and the combination of our immigration laws and the combination of the lack of supports for people to stay in their homes, all of those things contribute to what's going on in long-term care. And this bill is really, is a first step at addressing what, quality workforce and oversight. And so I think it's a good start. I haven't worked my way through the whole bill, but I think we're going to see some movement on that too, I think.
Massachusetts has kicked some of those equity companies out of the state. Yeah, they banned a couple of people. I found one nursing home where
Oh, the nursing home, yes, okay, yeah. Yeah.
they just said, your license is lifted.
Yeah.
Goodbye.
Yeah. The problem is that it's really hard, the way that private equity will often work in those situations is you can tell the owners right above, who've opened it, but you don't see the whole financial structure. So there are so many corporations and so many limited liabilities. The New York Times had this amazing picture of long-term care financing and private equity, you could not read it. There were so many boxes with so many arrows going in all different places because they make it really opaque.
They'll come in, they'll buy the whole thing, they'll split the property
Yep.
from the fund
Oh.
and charge them a higher rent. and
Yeah,
how
that's
they-
what, the real estate trust, and that's what they've done with the hospitals. That's what's happening with Stewart Hospital and a number of them where they've come in and just, and so what happens is they will assume the mortgage or they will buy the property, then they rent it back to you, and it's such an exorbitant price that you can't put any of the money into operations. You put it into paying it back, and so the hospital eventually goes under or cuts any unit that doesn't make a lot of money. I mean, it's sick. It's really immoral on every level. So
So I'd like to
Okay.
call on Phyllis now.
I'd like to know where you stand on Senate Bill 1638.
what's that,
An
Phyllis?
act to provide fair and affordable public retiree benefits.
Oh,
It's
which one
already-
is this?
This is the one that deals with the fact that we have historically been capped at 3% over the past 10 years, except for the 1 year at 5%. And it's based only on the first 13,000 of
Oh,
my
yeah,
pension,
yeah.
okay? And so we are asking.
The COLA. Yeah,
Exactly.
okay, yeah. So who's carrying that bill now, do you know?
Julian Sear
Oh,
and Dan Donahue from the House.
okay. So that will go to,
It's going
To
to the
Labor?
Joint Committee on Public Service tomorrow.
oh, Public
for
Service
hearing.
tomorrow,
I know I'll
okay.
testify.
Oh, okay, great. So I think that's kind of crazy, 3% on the first 13,000. I think it's time to update that. So I'm certainly supportive of that. I will have to wait to see how it comes to the Senate, if it comes to the Senate, and then yeah. But in general, I think that's 3% of 13,000.
$300 a year.
I was like, yeah. So it's a.
It didn't cover the cost of one purchase.
Yeah, no.
So from the mass retirees, what they sent us in our newsletter, and they said that basically Massachusetts tax collections dropped nearly 1.5 billion below benchmark expectations in April.
In April, yeah.
And House leaders feared the drop in revenue was on the horizon and had cautioned on this. So our proposal to increase the state/teacher COLA base by $3,000 from the current 13,000 base established in 2011 to a new 16,000 base would add some 1.5 billion dollars to a new unfunded pension liability. To pay off the unfunded liability by 2036, which is the current date of full funding for the Commonwealth, would cost approximately $150 million a year. So I guess that's why.
That's why they couldn't come to an agreement on doing anything, because the current numbers didn't look good for incurring more liability.
Yeah, and I think that's why the Senate's tax package is the way it is. So the House tax package in total within the next 3 years, it won't happen this year, but will be about $1.1 billion in tax money coming back to people. The Senate is 578 million. And there was a very strong belief in the Senate that we don't know what's coming. And if we, we did experience that the below benchmark that came in April wasn't totally unexpected because of some, I think it was, I know, it had something to do with unearned income coming in, the taxing, and so they felt like because of when this money was coming in, that people were probably going to wait another couple months to actually pay those taxes. It was something about the lining up of when the taxes were due, and so it wasn't totally unexpected. What is of concern is that there's a $2.5 billion said ARPA funds that the federal government is claiming we need to pay back because we used it incorrectly. That it was, now, that, people don't quite understand, and to the Baker administration's credit, they did a number of months ago notice that there was a lot of money in one of these particular funds, and so they did an audit, and the audit came back fine. They did another audit, and it came back fine. They did a third audit, and somebody finally found something. Now, we're still not clear, because all of this ARPA money came in, and we put it into a bucket, but it was all around unemployment insurance. Well, most of the money that's come in for unemployment insurance has come in through ARPA, and it's federal money. And we use federal money for, the $600 checks, the $300 checks, and what we did for independent workers. But that was all kind of ARPA money. So people are still trying to figure out what it means. And we think, the federal government, while Biden is in office, has been very good about, engaging in conversations. But we still don't know. And so we felt really uncomfortable saying, well, let's take $1.1 billion out of our revenue to pay for things like capital gains, like short-term capital gains, like short-term, single sales tax, things that, like $5 million for an estate, things that really support either large corporations or wealthy people. Let's just wait. And if we're going to focus on tax relief, let's do it for things like in-dormant tax credit, the estate tax, a number of things that we believe, the senior circuit breaker taxes, right? Things that really we think help people stay in their homes, reduce their taxes for the middle and lower income. And that's what the Senate package reflects. So we'll see what happens there. But these are examples of why people are nervous, and why we don't want to just rush into huge tax breaks for everybody.
I understand that, from what you're saying, but the fact is, I also don't want my quality of life to decline.
Right, and nobody does, right? And so that's what we're, that's what we're
The
looking at.
thing is, look, there hasn't been a change to this in the last 12 years. It's
Oh,
been
I
on-
don't disagree.
It's been on
Yeah.
13,000, the
Yeah.
first 13,000 of your benefit since 2011,
Right.
2010. Social Security gave what? How much did Social Security give? 8.7%.
7.8%.
Okay, just for the past year
Yeah.
for a cost of living increase.
Yeah.
On the
So-
whole thing.
So the
Right.
public retirees in Massachusetts are really not being treated fairly after a decade of inaction.
Don't pick on the 8.7 as if it was some windfall, because if you look at the previous years.
Yeah, it was very,
It was
Based
small.
upon a different basket of
Right.
goods that don't apply to senior citizens. They didn't consider people buying medications, that type of stuff. So the previous years, there was a terrible shortfall on Social Security increases. The 8.7 didn't make up for the past offenses, so.
Right.
No,
Yeah.
but
The
at
Social
least they're,
Security benefits
at
is-
least
is
they're
still
getting in
behind the
line
game.
now with the way they're going to do it, going forward. Right?
Yeah, they're
Yeah.
yeah, well, that remains to be
Don't
seen.
look at promises
Yeah.
until they
Yeah,
actually do it.
that kind of remains to be seen. And it will make a big difference about who's in the White House and who's in Congress.
Please help us.
Yeah. Other questions or concerns or, hi?
Yeah, I'm personally very concerned about the people who have been protected on Mass Health for the last 3 years, and now have to redetermine and go through the renewal process, open the envelopes, understand what the heck it says to do, or not be found because their address has changed. And, I know that unlike other states, we haven't rushed to take people off,
Right,
and do irreparable damage.
yeah,
But, I'm really concerned that at the end of the day, there's gonna be a lot of people in the emergency room, more than now, who won't have coverage, and they won't have easy access to
Right.
the system.
Because, you're
So-
saying that because they have to renew?
they have to they have to be
Everybody has to
redetermined.
reapply, yeah.
To be replied. That's a federal requirement. So you are right to be concerned. Actually, there are numbers of us who are concerned. There's about $10 million in the Mass Health budget to help just with redetermination. They've hired places like Healthcare for All who are doing proactive community outreach to people who don't speak English or who don't, who aren't going to open up their, the other piece of it is that we are pushing very hard, and we actually got it in the Senate budget to increase the subsidy on the connector so it goes higher than 250% before you lose a subsidy for health care. So there's a number of things that are going on. There's a lot of eyes on it. Somebody's going to fall through the cracks because the system is huge, but there is enormous amount of work being done to try and protect people and ensure that when you lose it, you
One of the issues we've seen is with the Mass Health computer system not being able to fully capture the increase in Medicare Savings Plan eligibility. So sometimes we're looking at people who need to file 2 applications or who file one and get bounced out together. So
Yeah. It's not easy, and they're so bound by what they're required to do by the federal government and what they're, they have a certain leeway. But if people are having trouble, and certainly if they're in this district, call us, because we can focus we can get access to people at Mass Health to help them. But people do, I will say people really care. So it's not like being in another state, which I won't name, where they really don't care.
Yeah, a couple years back, my son was on Mass Health, and somehow it got all messed up, and I called Ken, and he had his assistant talk to my son, and they fixed the whole thing.
Yep.
And it was
So it's
a one phone call
Yeah.
deal.
Yeah.
So is
Now
there
he's
any,
going to work
is there,
for the IRS. He just got
so is there
hired
anyone
today.
else that has a last topic before we close this out? Senator Friedman's been with us for a while now, an hour.
Do you-
Yes, Alex?
So the T system has had a really terrible year, with all the breakdowns in construction, disrupting everything. And they replaced the people in charge, but what is the legislature planning to do to help?
Well, we're giving them a lot of money. We have we now have, because of the Fair Share Amendment, half of that tax money that's coming from people making over $1 million, half of that is going to transportation. Let's be clear, when you don't take care of something for 30 years, you can't fix it in a month. And the hardest thing that we have before us is to keep fixing it. Even though right now it looks horrible, if we stop, it will just be worse. So it's really hard to get government to pay attention to things that take a long time. But that's what we have to do. But we've given money to the T. There's actually, I think, money proposal in the Senate budget to do a means test for affordability in pilots in the T, so people making a certain amount of money, get a reduced cost, or but we just have to keep our eyes on it and ensure that people that they're doing what they need to do. I mean, they don't, like the fiasco with the cars. I don't think we've seen one car from the company that we paid to build them. I don't think we've seen one yet that's worked.
Supposedly, out in Springfield.
Springfield, yeah.
The red line cars are just
Yeah.
stuck there.
I mean, and that's probably, we got it on the cheap, and, false promises were made, and people didn't, you have to really care, and you have to pay attention, and you have to stick with the ups and downs. And I don't think this past, I I don't think we've had a really strong interest in public transportation, probably since Mike Dukakis.
Exactly. Thank you.
And now we're paying for it. So the legislature can give money, the legislature can require certain quality measures, but we can't fix it.
Well, once it all gets fixed, Cindy, when are we gonna start looking at high-speed rail?
They are working on the South Coast.
And I'm not even talking around here, I'm talking west to east.
Oh, yeah, so that, they're still fighting the west to east. You know what I found out, though? You can't, I don't understand how this works in other countries, but you can't do high-speed rail evidently through certain places because the sound is it's so loud that if you go through a town, let's say, in a high-speed rail, it's deafening. So I don't know how when you get to, and this is way beyond my understanding, but I don't know how when you get to the towns in Massachusetts, of which, you sort of hit Worcester, and then there are many, how that all works with high-speed rail. I don't.
Other countries have done it, so maybe a
Yeah.
feasibility study.
Yeah, but or how about just a good train that works and that, has a.
Yeah, but I mean, here's the thing, I grew up in Chelsea, I live in Burlington, right? My world is around 128.
Yeah.
Okay? But, I mean, the world's bigger than that, and we have public
Really?
transportation. Well, I'm a master of the obvious. And we have all this public transportation around here.
Yeah.
It doesn't work quite right now, okay, but we have it all around here. You go west,
Yeah.
we could use some improvements.
Yes, and we've done some significant investment in the RTAs in this Senate budget. So people our central and western colleagues are very happy about that because money's going to there.
Right? It's just
Yeah.
like either you're about me or you're about we.
Yeah.
I like to be about we.
Yeah, exactly. Yeah.
Okay.
All right, Cindy, thank you very much.
Thank
Oh,
you.
you're welcome.
Thank you.
Well, you all know where to find me. Certainly Janice and Larry and Phyllis do. And I'm happy to, my office is phenomenal. My constituent service person, Fatou Sidibe, is amazing. And we're happy to help. And then if there's other issues or you want me to come back and talk or whatever, I'm happy to do that.
And we
So
appreciate
thank
you
you.
and the work you're doing.
Well, thank you.
Absolutely.
Thank you. It's
Absolutely.
it's good to have support, so I really appreciate it. And we'll look into these things and I'll get back to you.
That sounds great. Thank you very much.
All right, everybody.
All right.
Thank you.
Thank you.